Hello guys, so now we shall be discussing regarding herpes simplex virus type 1. Okay, so topic of discussion will be herpes simplex virus type 1, or you can call it as HSV type 1. So this would be our topic of discussion now. So we shall discuss all the possible details of this HSV1. Okay, so I want you to make notes as I am teaching you. So we have already spoke this thing that all herpes viruses, right? All herpes viruses, they have DNA, not RNA, right? They have a DNA, and this DNA is not coiled. This DNA is linear. Okay. So for all herpes virus, herpes simplex 1, 2, 3, 4, 5, 6, 7, 8, we have got around 8. Okay. So in all of these, if you look at the DNA, this is how the DNA looks, guys. This is the DNA, and this double stranded DNA, not single stranded, right? It is a double stranded DNA. Now what is this? This is a double stranded DNA. And this double stranded DNA, how is it? This double stranded DNA is enveloped. This double stranded DNA is enveloped. If there is no envelope, you call it as a naked. Okay, it is enveloped. So what can I write here? So it has got a double stranded DNA, and this double stranded DNA is linear, and this double stranded DNA is enveloped. Double stranded DNA is enveloped. So this is one of the important thing which you need to remember. Okay, so it belongs to which family? All the herpes viruses belong to Herpesviridae family. All of them belong to Herpesviridae family. All of them belong to Herpesviridae family. Now the most important thing which you need to know regarding this herpes simplex virus type 1 is, most commonly this HSV1 affects your oral mucosa. HSV1 most commonly affects your oral mucosa. It mainly affects your oral mucosa. Now the next important thing, what should we discuss? We have to discuss then how it is transmitted. It is very easy. You have to look at what part is affected. See, oral mucosa is affected. So it means from the mouth, what is gonna go inside? So the route of transmission will be somewhere here. So the route of transmission will basically be either saliva or the respiratory secretions. So route of transmission will be either saliva or respiratory secretions. Let us discuss the pathogenesis. Let us discuss the pathogenesis of this. Now regarding the pathogenesis, let me draw up a picture, guys, so that you would understand it better. For example, let us say this is the lateral side of the face. Okay, this is the lateral side of the face. Now let us say that here the patient has got his own brain. Okay, he has got his own brain. Now what I'm doing is, I'm just making a section of his spinal cord. Like for example, this is a section of the spinal cord, and let me show it up here. Okay, so when I show that section of spinal cord, how does it look, guys? So this is the central spinal cavity, and whatever I'm drawing right now before you, these are your horns. These are called as a horns. So this is a central cavity over here, and right now whatever I'm gonna draw, these will be your horns. Okay, these are the horns. and obviously all of you know this entire thing over here, it forms the spinal cord, section of spinal cord. Now exactly here in the section of spinal cord, if you very clearly look, you will find a bumpy elevation here as well as here. Now what is this? This is called, you know it very well, right? So this is called as a dorsal root ganglion, where only sensory nerves are present. Okay, so what is this called? This is called as dorsal root ganglion. Dorsal root ganglion. Now very fastly I'm going to tell you this thing, that if any of you don't know what is dorsal root ganglion, just keep that thing in mind. Look here, for example, always the first order neurons or the dorsal neurons, you know how do they look? Let me draw the picture like this. So this is the basic structure of a neuron, right? This is called as a cell body, this is called as an axon, these are called as the dendrites, you know this. Now how the dorsal root ganglion neurons they look is that this is how they look. This is how the neuron looks. Okay, so this will be the cell body, and cell body, the axon divides into two. One is the peripheral end like. Okay, so these are also called as pseudo unipolar neurons. So dorsal root ganglion neurons are called as pseudo unipolar neurons. So this is how they look. So if I put the same picture over there, how does the picture look is that this is how the picture looks. So this is a dorsal root ganglion having the neurons like this. The peripheral process is away, the central process is entering into the spinal cord. So this is how it looks. Okay, I hope you are clear with this picture over here, right? I'm rubbing it out now, right? So this is a dorsal root ganglion where only and only what nerves are present? There are only sensory nerves, not motor nerves. Motor nerves are present in the ventral part here. Dorsal side always there are sensory nerves. So let us get back into the topic now. Now what will happen is that this pathogen, right, this virus, basically herpes simplex virus, it enters into your body through the mucosal surfaces, through the wet surfaces. Where are the wet surfaces? Eyes are the wet surfaces. Inside the nasal cavity, that is a wet surface. The oral cavity, that is a wet surface. Why it is wet? Because the nasal cavity, oral cavity and the eyes, everywhere we have got mucosa, right? We have got mucosa. Mainly the mucosa is present in your mouth, right? So through this mucosa or through this mucus layer, it enters inside. For example, instead of mentioning each and everything, let me just put a box like this. Right, and tell you that this will be mucosa. For example, mucosa. This is a mucosa. Okay. Now, let us also say that this is the virus now. Herpes simplex virus. So this will be your herpes simplex virus. Now this herpes simplex virus, through the mucosa, it travels all the way through the mucosa, it pierces the mucosa and finally it enters into your body. Now from here it goes all the way, directly it goes to the spinal cord. Now from the spinal cord, it goes like this and enters into the dorsal root ganglion. And this virus, look here, this virus is gonna stay for some time, right? The moment when you land in any city, you directly look for a hotel or a motel, right? So the same thing here. As soon as the virus enters into your body by piercing the mucosa, it will straight away go to the dorsal root ganglion and start sleeping in the dorsal root ganglion. So if I write it, if I put it into a note, the first thing what will happen? Herpes simplex virus type 1 will pierce the mucosa, and from there this is going to go to the dorsal root ganglion, and within the dorsal root ganglion it is going to sleep. It means it will be dormant in the dorsal root ganglion. For how much time? It depends. It depends upon your immune status. So where the dormancy is occurring is very important. HSV-1 dormancy occurs in the dorsal root ganglion. Okay, dorsal root ganglion. Whereas cytomegalovirus, there is something called cytomegalovirus, that is human herpes virus 5. that is cytomegalovirus. The dormancy, I mean where that cytomegalovirus is going to sleep, that will sleep in the monocytes of your blood cells. Within your blood cells you have got monocytes, right? So it will be dormant in the monocytes, okay? But here HSV1 is going to be dormant in your dorsal root ganglion. Now when it is dormant, nothing is going to happen. The disease starts only when you wake up that virus. It is sleeping peaceful in the dorsal root ganglion, and if you wake that up, waking up is called as reactivation. If you reactivate that virus, the disease will start immediately. Okay, so how does the disease start? Disease will start upon reactivation of virus. Reactivation of virus. If you are reactivating it by chance, then you need to face the consequences. Okay, can you please tell me how will the virus get reactivated? Yeah. So the virus gets reactivated in mainly 4 ways. Okay. For example, point number 1. The virus has entered into my body through the respiratory or the salivary secretions, and now right now the virus is in my dorsal root ganglion. It is dormant in my dorsal root ganglion. Let us say maybe I had some transplantation. Let us say I have got some surgery, let us say, or let us say I have contracted some disease. So as a result of transplantation or a surgery or contracting a disease, so in all these conditions, what is happening? My immunity is becoming low. My immune system is getting suppressed. Okay, my immune system is getting suppressed. So in a immune compromised patient, let us say for example I have HIV now. If I have HIV is a immunocompromised state, it means my immune system is getting damaged, is getting weakened day by day. So when my immune system is getting weakened day by day, that is the time this herpes simplex virus will wake up. His immune system is so weak. Now even if I attack, it might not take that much time or that much risk for me to attack him. So I'll immediately go and attack him. So HSV virus waits till your body's immune system is weakened. Okay, till your body's immune system gets weak. So till then the HSV1 virus waits. So once your immune system is weak, then HSV virus undergoes a reactivation and start damaging. So what all things it will damage, I'll tell you. What all things it is going to infect, what all things it is going to affect, I mean the eyes, the nose or whatever it is, I'll tell you that. But first thing you need to know, what are the trigger factors of reactivation? The first thing is immunosuppression. Immunosuppression. Second thing is long-term exposure to sunlight can also cause a reactivation of this virus. Third important thing is, for example, in patients of emotional stress, okay, and finally, if you are doing any kind of manipulations of trigeminal, if you are operating in the face region, or if there is any kind of disturbance to the trigeminal nerve, even then also the virus can get activated. So any kind of trigeminal nerve variations or manipulations. Okay, so in these cases basically the virus gets reactivated. So can I call these factors as the triggers? They are called as the triggering factors, right? So these are called triggering factors. So these triggering factors, they cause so and so things like immunosuppression, sunlights, triggering factors like immunosuppression, sunlights, immunosuppression or immunodeficiencies. Any kind of AIDS is an immunodeficiency condition. So emotional stress, trigeminal nerve, all of this. I hope you understood. Now look here. Now important thing you need to know is that once the virus has got reactivated, what will happen is that it will affect your eyes, it will affect your brain, it will affect your skin. But whatever it is affecting, you know how does it affect? It will form, reactivation will form, when there is a reactivation, this reactivation will form pustules. Okay, This reactivation will form ulcers, there will be ulceration, there will be pustules formation, and there also will be scabbing, scab formation, scabbing, and not only that, there will also be vesicles formation. Vesicles will also be formed. Okay, so reactivation will cause the formation of pustules, ulcerations, scabbing or vesicles on the surface of the skin. So mainly, what are the major problems? The major problems are, once the virus gets reactivated, then the virus starts multiplying into many number, and finally what will happen is that, look here guys, what will happen is that this virus can enter into the brain. Point number 1, it can cause problem in the brain. This virus can even enter into your eyes, and point number 2, it can cause problem with your eyes. I'll tell you what is that. Next, it will even affect your face. Okay, it will even affect your mouth, let us say the oropharynx region and the mouth and all. And what all problems it is going to cause? Point number 1, 2, 3 and 4. So point number 1 is that if it will affect your brain, it will cause HSV encephalitis. HSV encephalitis. If it will affect your eyes, it is going to cause keratoconjunctivitis. Okay, it will form vesicles, pustules and all on the eye region. If it will affect your face, it is going to cause Bell's palsy. I hope all of you know Bell's palsy is this damage to your facial nerve that will cause Bell's palsy. If it will affect your mouth, patient can have gingivostomatitis. 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 Out of this, here the important complication will be HSV encephalitis. Keep this thing in mind. Okay. So let us look at the pictures guys, then you will understand it better. See, the first picture shows a woman who has affected with this herpes simplex virus that led to the facial nerve palsy. Okay. Now you tell me, where is the facial nerve palsy, on the left or on the right? Obviously, if a patient is having facial nerve palsy, you will tell the patient to laugh like this, in this way. So when you tell the patient to do like this, if there is palsy on the right side will not have any kind of expression, it will be like this. If there is a palsy on the left, the right side will be contracted, the left will be dull. So this is called facial nerve palsy. So it means the palsy is on the right side for her. Right? So this is nothing but called as a Bell's palsy. Okay? Coming to the eyes, can you see small vesicles over here? You see, can you see some small vesicles, round vesicles over here? It is not that clear, but yes, I can see some small vesicles over here. Vesicles, right? Vesicle formation. So this is called as keratoconjunctivitis. So this is called as keratoconjunctivitis. Okay. Let us go on to the next. Look in the mouth. This is called as gingivostomatitis. What is this called? Gingivostomatitis. Okay. Right. And another thing is that not only these, even this will even affect your skin. So when it affects your skin, this is going to cause erythema multiforme, a rash called as erythema multiforme. Okay, erythema multiforme. Let me show you that picture. So this is erythema multiforme. So this erythema multiforme, this typical rash is also called as bull's eye rash. Okay, because it has got a scale in the center, a vesicle formation in the center. Surrounding this, there is a zone of erythema, right? In the center, there is vesicle. Surrounding, there is redness like a ring. So it gives like a let us say target appearance or bullseye appearance. You call it as multiple ways. So this is what? This is erythema erythema multiforme. This is erythema multiforme. Okay. Now, another important thing is that, as I told you, skin is infected leading to erythema multiforme, right? Even the lips are also affected. So when the lips are affected, so as I told you, the skin will be infected and it will lead to erythema multiforme. So even the lips are also affected, obviously, because the main transmission is through mouth, right? The saliva and the respiratory secretions. So there is no surprise that if the lips are affected, okay? So in the lip region, you see small vesicles like this, round vesicles, yeah? So these vesicles over here, this entire lesion, whatever is there, this is called as perioral papillovesicular lesion. This is called as perioral papillovesicular lesion. Perioral papillovesicular lesion. Okay. Now let us discuss regarding the complications, guys. So what all complications I will have? What all complications he might have? The first important complication I told you, that would be HSV encephalitis. HSV encephalitis. Okay. Next, this virus can sometimes affect your esophagus as well as your lungs. Okay. So it will even cause pneumonitis. So only three complications: HSV encephalitis, pneumonitis, and even it will affect your esophagus. So HSV esophagitis. HSV esophagitis. These are the three important complications which you need to remember. Okay. Okay, fine. How will I diagnose? So basically the diagnosis is based on physical examination. If a patient is having that papillovesicular lesion on the lip, by looking at that we can tell that this is herpes simplex virus type 1. But if you still wanted to show the proof to the patient, right, you can do a diagnosis called as Zank smear test. Zank smear. So on the Zank smear, what will you find? What will you find is that, let us say that this is a cell over here. This is called as a neutrophil. Okay, I am naming it as a neutrophil. So this is your neutrophil. You know, neutrophils are bilobed like this. This is a neutrophil, for example. Okay. Now neutrophil. Now within this neutrophil, you will find some specific bodies like this. These are nothing but viral inclusion bodies. These bodies are called as viral inclusions. The virus has entered into the neutrophil, that's it, and started replicating. So these are viral inclusion bodies. Viral inclusion bodies. So when you biochemically, when you look at them, it is made up of nucleic acid and protein. It is made up of what? Nucleic acid as well as protein. It is made up of nucleic acid as well as protein. Okay. Now these bodies are also given another name. These bodies are also given another name. That name is Cowdry type A bodies. Very important for your exams. Very important for your exams. These are called as Cowdry type A bodies. Cowdry type A bodies. So they are nothing but, what is Cowdry type A bodies? They are nothing but the viral inclusions. Okay, made up of nucleic acid as well as protein, which mainly affect your neutrophils. So can I find this Cowdry type A bodies anywhere? Yes. You can even find these Cowdry type A bodies not only in HSV-1, you can also find them in HSV-2. You can also find them in varicella zoster virus. So in these three cases, I can see these bodies. Okay. So this is how you do the basic diagnosis. Now, the last important thing you need to know is that the treatment plan. Obviously, this is a virus. So when virus is affected, I give antiviral drugs. So acyclovir, Acyclovir is the drug which I give. Valcyclovir, right? Acyclovir, valcyclovir and famciclovir. So basically 3 groups of drugs which you give: acyclovir, valcyclovir and famciclovir. Okay, these are the 3 basic group of drugs which we basically give. So these are some of the important points, guys. Zang smear is very important for you. You just have to remember about Zang smear, right? Let me mark the MCQs over here. Zang smear is very important. Cowardly bodies type A, I have already marked, very important. And where do you find these bodies is also very important. And it is made up of what is also very important. Next, most important complication will be all these 3. Remember this thing, important complications. Next, yeah, where it is gonna get dormant? Obviously in the dorsal root ganglion. So this is also an MCQ. Now you have to remember these 5 things, guys. Very easy. I have already told you it will affect your brain, encephalitis. It will affect your eyes, leading to keratoconjunctivitis. The 7th pair of cranial nerve, leading to Bell's palsy. Next, mouth, gingival stomatitis, the skin, erythema multiforme. Okay, these 5 are very important. Okay, now if you look at this specimen over here, in this histology, in this biopsy, you can see these bodies here, these bodies over here, right? So these bodies are nothing but called as Cowdry bodies. These are called as Cowdry type A bodies. Very important, right? So these are the basic things which you need to know regarding the herpes simplex virus 1. So thank you so much for watching my video. Goodbye.